Welcome, everyone. This webinar is about Inclusion Canada's new position statement on access to healthcare. My name is Robin Acton, and I am the past president of Inclusion Canada. I am also a parent. My daughter, Erin, has an intellectual disability, and my husband has a significant physical disability. Our family has many experiences with the healthcare system. We have seen the very best of it and experienced firsthand the often unconscious ableism that can literally threaten lives. I'm excited to share our new position statement with you. Equitable access to healthcare is possible. Before we begin, I would like to run through some housekeeping and accessibility items with you. Today's event will be 1 hour long, with approximately 40 minutes of presentation and 20 minutes for questions and answers. This event will be presented in English, French simultaneous interpretation, ASL, LSQ, and English and French cart captioning are also provided. To turn on English or French cart captioning, please click the link provided in the chat box. The cart captions will appear in a new window. Using the toolbar along the top of the window, you can adjust the caption size, font style, and color. You can also change the background color. To turn on French simultaneous interpretation, please go to the toolbar along the bottom of your screen and click the arrow next to the interpretation button. An option menu will appear. Click French. You will now be able to hear the French interpreter as well as the original audio at a much lower level. If you prefer to remove the original English audio, click the interpretation button again and select Mute Original Audio. You will now hear the French interpreter only. We are also pleased to have American Sign Language and Langue des Signes de Québec, LSQ, interpreters with us today. ASL and LSQ interpreters have been spotlighted. They will be visible on your screen at all times. If you are not able to see the interpreter, please check that your Zoom window is set to gallery view. There will be questions and answer at the end of the event. You can submit questions using the Q&A function at the bottom of your screen. We understand that the Q&A box may not be an accessible format for everyone, so questions can also be submitted by email to forum@inclusioncanada.ca. It may not be possible to respond to all questions. If you have technical difficulties, please let us know by email at forum@inclusioncanada.ca, and we will do our best to help you resolve them. To avoid common issues, please make sure you are watching the webinar from a location with a strong internet connection and that your computer's volume is turned on. Okay, let's begin. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the land which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all Inuit and First Nations people and the chosen home of the Métis. Our first speaker today is Ken Pike, the Director of Social Policy at Inclusion New Brunswick. Many of you will know of Ken's professional contributions both in the areas of medical decision-making and in promoting inclusive mental health care for people with an intellectual disability in New Brunswick. What you may not know is that Ken is also a sibling of an older brother who lived with Down syndrome. Ken will be offering you an overview of Inclusion Canada's new position statement and sharing some insight as a sibling.
Thank you, Robin. It's a pleasure to be here, and good day to everybody that has joined. In my presentation today, I'm going to walk you through Inclusion Canada's new position statement on access to healthcare. I was part of the committee that drafted the statement. I was joined by self-advocates, family members, and academics who all have a connection to intellectual disability. My connection is with my older brother, John. John was one of 7 children in our family and was a valued and integral member of our family and his community. As the oldest brother, he took on the role of protector for our 5 sisters, often interrogating various boyfriends that our sisters brought into the home from time to time. He was very much a gentleman who loved spending time with people, listening to music, dancing, and just being around and experiencing the richness of life. John also experienced dementia in his late 50s, as many people with Down syndrome now do. Strangely, this is a reflection of some progress. Access to healthcare has come a really long way. In years past, many people did not live long enough to experience dementia. For the most part, John had pretty good experiences with our healthcare system, as medical professionals accepted and understood the important role of family in ensuring that he had the care he needed. So healthcare has a big impact on people's lives. What we saw during the COVID-19 pandemic, the pandemic was actually what brought Inclusion Canada to put more of a focus on promoting equitable access to healthcare. With that said, people with an intellectual disability are not sick. They don't have a disease that needs to be cured. It's important that we continue to shake off the medical model of disability and promote human rights. But people with an intellectual disability are more likely to have other health conditions. Because of these other conditions, people with an intellectual disability are more likely to need health services over their lifetime. A big reason why people with disabilities face barriers to getting health services they need is because of ableism. Ableism is the belief that it is normal not to have a disability, and it is better to be normal. So ableism is a kind of discrimination. Anyone can have ableist beliefs. This includes health professionals. Because of ableism, they may ignore what a person with a disability tells them about their health needs. They may blame a person's disability for symptoms they are having. And you see this a lot in the mental health care systems. Or they may not provide health care because they don't think it will help the person. Being discriminated also hurts people's health, causing them to need health care in the first place. For example, ableism also prevents people from getting a good education and a job that pays well. Without enough money, people can't afford good food or safe housing, medication, and other things that might help keep them healthy, like exercise and participation in community. However, in designing this position statement, it was also very important to Inclusion Canada's network of families that we emphasize that people with an intellectual disability can have positive experiences with our healthcare systems. We have seen many examples of this. My brother John is one person who did overall have a positive experience. There are several things that make accessing healthcare easier for people with a disability. These include having a strong support system, having experience about advocating for yourself, and having a process you use to make medical decisions. Lastly, having long-term relationships with well-trained and open-minded doctors and other health professionals. We saw some of these things work for my brother, particularly with acknowledging the important relationships in his life and having good processes for making decisions about healthcare. For example, it was important that John have the time he needed to understand things, and having information provided in ways that he could best understand. So we needed to give those him time to make some of those decisions for himself. Inclusion Canada's position statement on healthcare explains actions to make access to healthcare better for people with an intellectual disability. Here are some of the ways that you can join us in taking action. First, you can help remove barriers by changing systems. Let people with disabilities direct their own healthcare. This requires promoting healthcare plans that are unique for each individual person. This could include offering accommodations like in-home appointments, longer appointment times, and sensory-friendly exam spaces. Support people with disabilities to be involved in their healthcare decisions. By recognizing supported decision-making as a legal way to make decisions, people with disabilities can have more control over their healthcare. We did not have supported decision-making laws back in the days that my brother was dealing with dementia, but we were able to provide this help informally. And having trusting relationships with his siblings provided John with the understanding that he had people who knew him well to look after some of the details about his medical care. And this was really important to him. One way that Inclusion Canada is working to advance this goal is by promoting easy to use health information. And Donna will tell you more about this work in a few minutes. Next, we need to provide support for people to navigate complex systems. Some people also have complex health needs they need to address, and healthcare systems are complicated. The government should be investing in navigators to help people with an intellectual disability find and access what they need. We need to require healthcare workers to take training about disability, ableism, barriers to healthcare, and accommodations that people might require. This training could be or should be designed and led by people with intellectual and other disabilities and their family. You can also work to promote truly inclusive healthcare, and this is which will be healthcare that everyone has access to across Canada. We need to avoid separating people with disabilities in special clinics, and we do this by ensuring that our healthcare systems have the capacity to serve everyone equally. Sometimes community-based healthcare workers may need to consult with other professionals. In some situations, they need to refer a patient to someone who is an expert. And a network can bring together medical professionals who have experience supporting people with an intellectual disability within a particular specialty area. We also need to recognize that people with lived experience are experts in their own lives. This means listening to people with disabilities. They know their bodies best. It also means including trusted family members and support people. They play important roles in accessing health services and can help with communication and supported decision-making. Next, you can help work together to improve access. This could require a number of things. First, we need to look at investing in research. A focus on disability should be part of a national health research program. This research could help to create better policies, and the government should be always work to improve the health system by testing, evaluating, and improving how we deliver healthcare. We need to be able to track how easy it is to access healthcare. We need to pay attention to what works well and where we need to make things better. We also need to fund and deliver a national intellectual disability mental health strategy. People with an intellectual disability have a right to adequate and effective mental health support. Research shows that 30 to 40% of people with an intellectual or developmental disability will have a mental health concern sometime during their lifetime. Our mental health systems are often not equipped to provide effective support, and we see this on a regular basis in our work here in New Brunswick. For my brother John, it came after the loss of our mother when he became depressed while trying to deal with his grief. The health system went quickly to providing medication when good grief counseling would have been a better option. Next, we need to also include people with disabilities in emergency response plans. The government has plans about how to prepare and respond to health emergencies. So we all have had the experience of COVID-19, and this was an example of a true health emergency. People with an intellectual disability need to be meaningfully considered as these plans are developed and implemented. Next, you can help to make change across Canada. We need to adopt a federal health equity strategy for people with a disability. Health equity is about how we divide our resources in a way that makes sure individuals and communities have what they need. A federal health strategy should address access to healthcare at all levels. Should address also non-medical things that influence health, like education and work and income. These are sometimes called the social determinants of health. And it also has to address ableism in the medical system. The strategy should involve lots of different kinds of medical professionals. It should be co-designed with people with an intellectual disability and their families. Lastly, we need to make disability inclusion part of all healthcare changes. This is an important issue all across Canada. People with an intellectual disability and their families must be considered and included. Thank you.
Thank you, Ken. Our new position statement is now hosted on Inclusion Canada's website in English, French, and plain language. Our next speaker is Donna Brown. Donna Brown is the first Vice President of People First of Canada and the former President of People First of New Brunswick. She is passionate about creating a world that is truly inclusive. Donna has also been advising our work in Inclusion Canada and has been doing a lot to support people in public health to make health information more easy to use. Over to you, Donna.
Thank you, Robin. I'm ready anytime, Monica.
Okay, great. So we are going to, Donna's going to present. We're going to do a little question and answer situation here. So Donna, first question, Ken just talked about things that people who work in healthcare can do to make healthcare more accessible. So what do you think about Inclusion Canada's suggestions? What stands out to you?
I think that having information like this is a good place to start. It's important that healthcare is accessible. Everyone has the right to have clear information about their own health. I like the goal of making sure that self-advocates are supported to make their own decisions. That's important to me. The position statement also talks about having information in easy-to-use format. That makes a big difference for people. That's important for me too.
Great, thank you, Donna. So you've been an advisor for a few projects now with Inclusion Canada. The first project did research and looked into why people with an intellectual disability weren't getting the COVID-19 booster at the time. What did you learn in that project?
Well, In that project, self-advocates and family members told us that one big problem was they didn't understand all the information. Details about COVID and the vaccine were complicated. There was so much information and it was hard to keep track of everything. We learned a lot from people in that project. They just wanted the information to be clear and easy to find.
Okay, thank you, Donna. So what were some of the barriers to getting health information that you heard about in that project?
One barrier we heard was about choice. In the research, self-advocates told us that when the government is sharing information about healthcare, it is really important to talk about choices. They don't want the government to tell them what to do. Instead, they want to know what the options are so they can make a choice about their health. That's important. Another barrier was about how information wasn't clear to everyone. Because people need health information in plain language so that everyone can understand it. And then we need that information right away. There shouldn't be a delay to get health information in plain language. That's important too.
Okay, Donna, thank you for those points. Last question for you. Do you have any other advice for doctors, nurses, or people who work in health policy? What's important to you?
Okay, this is my advice. Don't use big words and don't make it complicated. Use plain language so we can all understand what you are saying. Or even better, use an easy read format. Pictures and less words make information much more accessible. Also, listen to self-advocates and what they are saying about their own health and their own concerns. Sometimes it feels like people are not listening to what we are saying. And we need to have patience for people so everyone has the time to understand. Healthcare should be accessible to everyone. That's important. Thank you.
Thank you, Donna. That is a very important message. I really appreciate both Ken and Donna highlighting what can be done. For the vast majority of our interactions with the healthcare system, our family met with well-intentioned, compassionate health professionals. But well-intentioned and compassionate didn't equate to equitable access or ableist-free treatment options. Often we had to point out the underlying bias and assumptions. There is lots of public concern about healthcare in this country and much discussion about change. It will take all of us, individuals themselves, families, allies, and healthcare professionals to advocate for a system that serves all equitably. Our next speaker is Manal Miri. Manal's work is about helping ensure that voices of people with intellectual disabilities and their families are heard at the national and international level. Manal, can you come off mute when you're ready?
Sure, yes. Thank you, Robin. Hello, everyone. Good afternoon. It's a pleasure to be with you today. So yeah, I'm Manal Miri. I'm the Global Advocacy Manager of Inclusion International. I'm also a sibling of a person with intellectual disabilities, and I live in Tunisia, which is a little country in North Africa. I am a woman in my late 30s with brown and curly hair. I'm wearing a navy blue poncho over a dark red jumper today. Next slide, please. So just a few words first about Inclusion International for those who may not know us. We are the global network of people with intellectual disabilities and their families. We have members in more than 100 countries, and Inclusion Canada is one of them. Next, thank you. What we do as an organization. So because we are a members-based network, one of the things we do is that we support our members through projects and programs. We also bring our members together to network at events, working groups, or discussion groups. And one of our main role, as Robin said, is to ensure that the voices of the members are heard in international platforms like the United Nations, where we do advocacy. And this is my main role in the organization. In the webinar today, I'll be speaking about the work we do on health and will specifically share the work we did with the World Health Organization on their global report on health equity for persons with disabilities, which I could see that many parts of Inclusion Canada's position paper are reflected on it, which is really great. Just to give you some ideas first about how we choose the topics that Inclusion International work on, because we are an international network and there are so many areas to cover, and because people with intellectual disabilities are part of the community, so all topics related to everyone's lives are important. However, because we are a small team, we have to prioritize our advocacy work. These priorities are guided by our members who choose the topics that are priority during the General Assemblies. Health has not been identified. The last GA General Assembly we had in 2018, health was not identified as one of the priorities for the network. However, while it's not a joint priority, it was not a joint priority for all the members, it is and has always been a very important topic in some regions and countries, like in Africa, for example. And I'll mention later some of the work they are doing there. Also, the COVID pandemic has revealed the weaknesses of healthcare systems all over the world, and the impact that it has on people with intellectual disabilities. I also talk briefly about this later on. No, can we go back to the previous slides, please? Yes, the same one. Yes, here, thank you. So in addition, health is strongly linked to other rights, like legal capacity, access to information, and many others. Next slide, please. So to give a few examples of the work that we do as global organization, or the work that some of our members do on health, I mentioned the following. So in Africa, as I said, health is a priority topic because of the multiple challenges that exist in accessing primary healthcare and the lack of services. Therefore, Inclusion Africa is doing a multi-year project on health, and many members are doing advocacy in their countries. We also currently have a project on legal capacity and sexual and reproductive health and rights. This project is in partnership with Women Enabled International, and it is implemented with our members in Indonesia, Kenya, Spain, and the United States. Next slide, please. During the pandemic, our global report called Our Agenda for an Inclusive Recovery included a chapter on access to healthcare. And we have seen how much health services and systems are fragile, and how people with intellectual disabilities have been among the most impacted during the pandemic. And I'll talk a little bit more about this later. A final example of the work we're doing is our involvement with the World Health Organization when we started to work on the global report on health equity for persons with disabilities. We joined the civil society consultation group, which was made of 13 representatives from international organizations and organizations of persons with disabilities globally. We have also supported our members to join regional consultations led by the World Health Organization. Let me just remember that this report was important because it targets governments all over the world because they are members of the World Health Organization. It is also a tool for them to reform their health policies. That's why it was important for us as an international organization to bring attention on the specific challenges that people with intellectual disabilities face in accessing health and enjoying their right to health. So we know that all people with disabilities face different barriers when it comes to healthcare. Some barriers are common with other disability groups, like accessibility of health services or the lack of accessibility of health services, the costs that might be related to accessing health services, the availability of these services in urban and rural areas. But there remain some issues that are particularly important and specific to people with intellectual disabilities. Next slide, please. So we tried during our work and our consultation, the consultation with the World Health Organization, to share these important issues that count for people with intellectual disabilities. So firstly, an equal right to health is very much linked to the right to make decisions. And Ken mentioned this and talked about it earlier. So in many countries where people with intellectual disabilities are denied their legal capacity or their right to make decisions, violations of their human rights, in particular those related to their right to health, are happening a lot. For example, they receive forced medical interventions, forced sterilization. They are detained involuntarily in institutions under the excuse of being provided with care and other forced treatments. Second, we have also highlighted the issue of accessing information, whether it is in general health services or in situations of emergencies. And I'm happy to hear, I heard Donna talked about this a lot earlier. Having written information in easy to understand is vital. Doctors and other medical professionals should also be using easy language when they talk to people with intellectual disabilities and make sure that they understand their health conditions, especially before providing any kind of treatment. This might require, for example, more time during medical appointments for people with people with intellectual disabilities. Next slide, please. Another point that we discussed with the World Health Organization and insisted on is about sexual and reproductive health and rights, in particular for girls and women with intellectual disabilities. As I said earlier, this is a very important topic for many members. In some part of the world, girls and women with intellectual disabilities do not have any information about their sexuality and reproductive rights. It can also be a taboo in some contexts, which make cases of abuse and violations very, very high. Another point that we discussed is about the challenges that people with intellectual disabilities face in times of emergencies. And we have seen it lately, recently with the COVID pandemic. The COVID pandemic has revealed how weak healthcare services are and how discriminatory they are. We have seen triage protocols with people with intellectual disabilities have been identified as low priority for care. We have seen people with intellectual disabilities denied vaccines or put at the bottom of the lists. And we have also seen people with intellectual disabilities being denied access to health care at all during the pandemic. and not forgetting the high rates of mortality because of COVID that impacted people with intellectual disabilities in many countries in different parts of the world. Next slide, please. Another element we raised is the importance of including people with intellectual disabilities and their families when designing or reforming healthcare-related policies and programs by governments. This was also part of the Canadian position paper on access to health. During the consultations, we referred to our Listen, Include, Respect guidelines on inclusive participation, and we wanted to have them as a reference for governments to follow when consulting with people with intellectual disabilities. But unfortunately, we were not successful in having the guidelines mentioned in the global report. However, there is still a reference of the importance of ensuring inclusive consultations with people with intellectual disabilities and the use of easy read. Finally, our input, which was also shared by other organizations from other disability constituencies, was about the perspective to use in the report and ways to encourage governments to implement health equity for persons with disabilities. It was highly raised that the focus should be the human rights approach, and that all people with disabilities should have the right to good quality healthcare services, because it is a right, and not justifying this by a financial or cost effectiveness approach. In other terms, not saying that it might cost less if all health services were fully accessible and inclusive of persons with disabilities. Because even if it might be more expensive, and we know that maybe some people might require more support and then more resources, then governments should still ensure healthcare for all. Next slide, please. I will just finish by sharing some information related to what's coming next with relation to the World Health Organization Global Report on Health Equity. So currently, while the report was released by the end of 2022, they spent the whole year last year in disseminating the report between governments and with different states. Now the World Health Organization is working on a guide for action as a supplement to the global report. The guide for action is especially meant for governments and for health ministries or other health authorities to be a practical guidance for them to advance health equity for persons with disabilities. We have also been asked to contribute to this guide by giving feedback, and the aim is to have this guide released before the end of this year. So thank you very much, and I'm looking forward to any comments or questions you might have. Thank you.
Thank you so much, Manal. It's really great to see that Inclusion Canada's priorities align so well with the work that Inclusion International and the World Health Organization are doing to advance access to healthcare for people with an intellectual disability around the world. It's also really great to see that we have some time for questions and answers. So I'm going to remind you at this point in time, if you have a question, you can submit it two different ways, one in the Q&A function or by email to either through the Q&A function or by email to forum@inclusioncanada.ca. But I'm going to start off with a question, and I'm going to propose the first question to Donna. So Donna, I know that you were an actor in an easy to understand video about COVID-19 vaccines. So I'm hoping that you can comment a little bit about what that experience was like. And also tell us a bit about why in the video you asked a lot of great questions. And do you think it's important for self-advocates to ask questions about their health? Over to you, Donna.
Thank you, Robin. Well, for the first question, I really liked it that I've been filmed for the COVID-19 asking doctors for COVID-19 vaccine. It's a really, really great experience, and it's also fun. And also at the same time, I've learned a lot about COVID-19 vaccines, And what I've learned that the vaccine can only, it can't protect from COVID, but if it prevents from getting worse if when you caught COVID-19. That I already got COVID once, and I'm very happy and did not regret taking the vaccines because as I said, it it's not worse when you take vaccines, but for those who not taking the vaccines, there's a possibility can attack the COVID-19 attack in the lungs, and it's 50-50 chance. So yeah, it's very fun and I like to explore and I just love it. And for the second question, yes, it is very important that we ask questions. If we want to make good choices, we need to understand what's going on. And there are no bad questions. Just ask whatever you want to know. If we're not sure about what question to ask, we can talk to other people in our lives. Thank you.
Thanks, Donna. That was very helpful. So I'm going to now ask a question of Manel. And Manel, do you have an explanation for why some of your recommendations that applied specifically to people with an intellectual disability were rejected for the report with the WHO?
So I don't think many recommendations were rejected. In the contrary, I think that most of our recommendations were included. If you look at the report, you can find more than 100 reference or mention of persons with intellectual disabilities, which means that they are providing information or recommendations or mentioning the main issues that are specifically for people with intellectual disabilities. Maybe the one that I mentioned earlier in my presentation, which was not included, is the reference to the Listen, Include, Respect guidelines. I don't know why it was not referred, but maybe because it's a very particular guidelines or coming from one or two organizations, though they didn't want to mention it as it is, but they did mention easy read and the importance of making easy information, easy to understand information and accessible information for people with intellectual disabilities. We will still try to include them in the next document. So for in the more practical document that is coming, the guide to action, and we'll see. But yeah, I think that most of the recommendations we gave were included in the report.
Thanks very much, Manel. I'm going to now turn a question. Now, I hope I'm going to start with Ken, and we'll see maybe others want to wade in on this one. The question is asking, how do we get healthcare services in our own language and not just the language that the provider wants to use? Ken, can you comment on that?
Well, yes, I did. certainly depends on where you live and the kind of rights around access to language equality. So here in New Brunswick, people have equal access to medical services and the language of their choice being English or French. And we've certainly worked to expand access to interpreter services for the deaf community. So it really does depend on where you are and what kind of language rights that may exist in a particular jurisdiction. And I know different parts of Canada, there are sort of increasing efforts to expand access to services in the language of one's choice. But we have a lot of people who are new to our country, and we have to find better ways of ensuring that people have opportunities to communicate if they're not yet well versed in our official languages. So I think we need to be very, I guess, in tune with other ways that we can provide good interpretation services for people who arrive in our country. For people with an intellectual disability, it's the communication issue is interesting, and people have touched on this during the presentations, but we know that people do communicate in a variety of ways and often rely on others to help express their wishes and preferences in the context of healthcare. So that becomes part of the important supported decision-making process, because not everybody uses the spoken word to communicate, and we have to recognize that we need to do better ensuring that people who use different ways of communication are able to be fully understood in the context of healthcare. So as we get better at supported decision-making and recognizing the roles of supporters who can provide adequate interpretation of people's wishes and preferences in the healthcare context, I think that's going to be there's going to be a lot of work to do in that context going forward. Hopefully that's answered the question somewhat.
Thanks very much, Ken. I would invite Donna or Manel. Do you have a comment you'd like to make on that at all? First, I'll ask Manel. Anything you would like to add?
No, I think, yeah, Ken mentioned everything. Yeah, it's all about ensuring to use the most adapted communication way that would work for not only people with intellectual disabilities, but for everyone. And yeah, this might vary, and it's about for the providers and professionals to adapt their way of working so it can be accessible to people with intellectual disabilities.
Very good. Thank you, Manel. Donna, if you'd like to comment on that question, please do. If not, I have another one for you. Are you ready for it?
I'm ready.
Okay. So Donna, the question is, somebody's asking, where can I get more information or training on how to create or use easy to understand health information? Do you have any ideas for that person?
Oh, okay. Well, maybe if you like contact to include People First of Canada or Inclusion Canada, maybe they can help you, give you a training or an easy to read format so you will understand better. Monica, you have something to add? Something to add?
I think what you've said is perfect. You're right. Contact either organization. you were talking before about some projects you've been involved in. You've been the advisor on 2 projects, and one of them is about accessible communication. So that project will be having some tools that it's going to share with people soon. So definitely check out the websites, hey?
So that's the websites of both organizations where you will see the results of those recommendations, both People First of Canada and Inclusion Canada. And Manel, I know that Inclusion International was involved in the Listen, Include, and Respect initiative, which was did some great work on accessible communication. Do you want to make a comment on that? Where could people go to get information about that?
Yeah, so 3 years ago from now, I think, Inclusion International, we have been working closely with Down Syndrome International to create guidelines on inclusive participation. And it's guidelines for organizations on how to ensure that people with intellectual disabilities are included, whether it is in meetings, conferences, communication, information, and different ways of communicating and involving people with intellectual disabilities. It was a 2 years process, consulting with persons with intellectual disabilities from, I guess, more than 60 countries. We had a lot of members involved from both Inclusion International and Down Syndrome International Network, which led to having these guidelines, principles that you can find now. They are on a website, they are published. I can put the website on the chat here, and you can find, so it's, for now it's in English and Spanish, and we're hoping to have more languages about the guidelines, but it can give you like step-by-step guidance on how to ensure to make any information or document or communication accessible to people with intellectual disabilities. And maybe one of the most important principles I consider is to make sure that people with intellectual disabilities are there from the beginning of the process of developing any kind of material. It's not about having a document and then translating it into easy read or whatever format, but it's important to have people with intellectual disabilities at all stages of developing the document, and also to ensure to ask people, because easy read won't work for everyone. And as mentioned earlier, there are different ways of communication. Some people might prefer videos, documents, or video communication. Others might prefer hearing or written or pictures. So it's important to consult people with intellectual disabilities, see what they would like, what kind of format they prefer, and from there develop the documents. I will add in the chat the link to the website. Thank you.
Thanks very much, Manel. Ken, I'm going to go to you now because I'm combining a couple of questions here, because I know you sat on the committee that developed the position statement on access to healthcare for Inclusion Canada. I wonder if you could comment on what that experience was like in terms of who was involved, and if you have any thoughts on what would be some next steps in terms of potentially partnering with healthcare professionals to make some concrete plans to address the issues raised by the position statement.
Yes, sure. There was a really interesting mix of people participated in the development of the position statement. We had good representation from self-advocates that talked about their barriers they experience in trying to access health care. We had family members that did the same and provided some good perspectives, and we had academics with some expertise in this area, including an academic who herself has has a disability. So it was a pretty well-rounded group of people. We didn't have, we had, one of our members was a former head of pharmacy at regional hospital service here in New Brunswick. We didn't have a lot in terms of medical professionals on the committee, but I think that is the next step, that we need to start reaching out to various professional organizations. A lot of work being done around how we support these different organizations, physicians, nurse practitioners, and other health professionals around breaking down barriers. And I think, opportunities for education and training, I think, would be the key next steps to help people understand how they can build their own capacities to provide effective health services to diverse populations, but in this sense to people with an intellectual disability, and what are the key things they need. We'd recently had the experience here in New Brunswick where the emergency department of a local hospital reached out to us to help them figure out how they could better support people with developmental disabilities that were coming into their emergency room. So they were recognizing that the noise and the chaos that often is part of emergency care was highly problematic for certain individuals, and in this context, it was individuals who are autistic. And so we need to do our outreach, and we need to let different health organizations know that they can contact us to work together to come up with some ideas and strategies and ways to build capacity within those health professions. So I think that's a logical next step. We have a position statement, and now that we need to use that as a springboard for further action with the different health professionals and organizations that exist across the country.
Thanks very much, Ken. I feel bad that we're not going to be able to get to all the questions that were posed in the Q&A, doing our best to cover the majority of it. Just before we wrap here, I'm going to give each of our presenters, I'm going to ask them if there was one thing that those of us who are participating in this webinar today could do to improve access to healthcare for people with intellectual disabilities. What would it be? So that's your question. You're going to have just 30 seconds to respond. So I'll give you a moment to think about that. But I do want to address that there was one question in the Q&A around our position statement does reference MAID, but Inclusion Canada has another position statement specifically related to MAID that I would encourage you to check out on our website. But for sure, we recognize that it is having an impact on healthcare, but that's a whole other subject. So I'm now going to go back to our presenters and ask them to give me a quick response to what is the one thing you would like people who participated in today's webinar to do. And I'm going to start with Donna.
Thank you, Robin. Well, the one thing it will be have clear information that make sure there is plain language.
Great. Thank you very much, Donna. Manel.
My thing would be, I would encourage you to get involved in consultations, contribute to consultations with the government, so you can share your needs, what do you want, and what changes you want them to make.
Thanks very much, Manel. And Ken, last word to you.
I think I'd like to see some real focus on preventative healthcare initiatives. How do we help people not get sick, and how do we use our health systems to provide better access to preventative care, better health screening, annual checkups, appropriate blood work, and all of those things that are really important in the context of healthcare. I think we let people languish too long, and then they're facing more serious health issues. So I would like to see our systems be a lot more responsive on that end.
Okay. All right. Thank you very much, everyone, for participating today. Special thanks to our presenters, Donna, Ken, and Manal. You really helped us think about this. And remind you all to please fill out the feedback form for today's event to help us improve future webinars. The link is in the chat and will be sent to you by email as well. Thank you very much, everyone. Have a great rest of your day.
Thank you.
Thank you.
Bye-bye.
Thank you.